Are you someone who's dealing with multiple health challenges? Or maybe you know someone who is? Well, you're in the right place because today we're going to talk about how to manage chronic illness and mental health. Did you know that around 150 million people in the United States have a chronic illness? And that number is only growing. That means that there are a lot of people out there who are dealing with the same challenges as you. But the good news is that you're not alone, and there are ways to manage these challenges. If you're dealing with multiple health challenges, then you already know that it can be tough. Whether you're living with a chronic illness, managing mental health awareness issues, or both, it can impact many areas of your life. It can affect your physical health, emotional well-being, relationships, work, and daily activities around your personal development school. For example, you might be dealing with physical symptoms such as pain, fatigue, or mobility issues, which can make it difficult to do things you enjoy or even take care of basic needs. You might also experience emotional challenges such as anxiety, depression, or stress, which can affect your ability to cope with daily life stressors. But here's the thing, you don't have to face these challenges alone. It's important to seek help and support from mental professionals, friends, and family members. And of course, we can't forget the importance of self-care. Taking care of yourself, both physically and mentally, is key to managing multiple health challenges. Communicate effectively with healthcare providers. Effective communication with healthcare providers is a crucial aspect of managing chronic illness and mental health. It can ensure that you are receiving the right treatment and care, improve your quality of life, and help you make informed decisions about your health. To communicate effectively with healthcare providers, you need to prepare for your appointments. This means making a list of questions and concerns that you want to discuss with your healthcare provider, bringing a list of medications and dosages you are taking, and being honest about your symptoms, concerns, and adherence to treatment plans. It is also important to ask questions and clarify any doubts you may have about your health or treatment. You can ask questions about the diagnosis, treatment options, side effects of medication, and lifestyle changes. This can help you understand your health better and make informed decisions about your care. However, communication barriers can sometimes hinder effective communication between you and your healthcare provider. For example, language barriers, cultural differences, and disabilities can make it difficult to communicate effectively. To overcome these barriers, you can use interpretation services. Bring a family member or friend to translate for you, or use visual aids like pictures or diagrams. In one instance, a patient who was not comfortable discussing their mental health concerns with their healthcare provider ended up not receiving the proper treatment, which led to worsening symptoms. On the other hand, a patient who was open and honest about their symptoms and concerns was able to receive the right treatment and improve their quality of life. Build a support system. Having a support system is crucial for anyone facing the challenges of managing chronic illness and low mental health awareness. Living with multiple health challenges can be an isolating experience in your own personal development school, and having a supportive network can provide a sense of community and belonging. When we talk about support systems, we often think of family and friends, but it can also include healthcare professionals such as therapists, counselors, and support groups. These individuals can provide specialized knowledge, guidance, and emotional support that can be invaluable in managing health challenges. For example, a support group for individuals with chronic illness can provide a safe and supportive environment for sharing experiences and feelings, receiving emotional support, and learning about coping strategies. Likewise, a therapist or counselor can offer guidance on managing anxiety, depression, and other mental health issues that often coexist with chronic illness. Meet Anna, who had been living with lupus for many years. Anna found it challenging to manage her symptoms, while also balancing the demands of her job and personal life. However, with the help of her family and friends, as well as her healthcare providers, Anna was able to build a support system that provided the practical and emotional support she needed. She joined a support group in her own personal development school for individuals with lupus, where she found a sense of community and learned new coping strategies. She also found that her employer was accommodating her health needs, which reduced the stress of managing work and illness. There's also John, who was diagnosed with both anxiety and a chronic pain condition. John struggled to find effective ways to manage his symptoms until he started working with a therapist who specialized in treating chronic pain. His therapist provided guidance on how to manage his anxiety, including breathing exercises and meditation, and also recommended pain management techniques that helped reduce his physical symptoms. John also found support in his friends and family who helped him stay positive and motivated. Support systems can look different for each person, and it's important to find what works for you, whether it's attending support groups, seeking out counseling services, or relying on close friends and family. Building a support system can provide the practical and emotional support needed to manage chronic illness and manage health challenges. Develop coping strategies. Dealing with chronic illness or mental health awareness issues can be challenging, and it's important to have coping strategies in place to help manage the difficulties that arise. Coping strategies are techniques or methods that individuals can use to manage stress, anxiety, or other symptoms associated with their condition. One of the most effective coping strategies is positive self-talk. This involves focusing on positive thoughts and affirmations rather than negative ones. It can help individuals build resilience and stay motivated, even in the face of challenges. Another popular coping strategy is relaxation techniques, such as deep breathing, progressive muscle relaxation, or guided imagery. These techniques can help individuals reduce stress and promote a sense of calm. Cognitive behavioral therapy, CBT, is another effective coping strategy that has been widely used in the treatment of mental health issues. CBT is a type of talk therapy that focuses on changing negative patterns of thinking and behavior. It can help individuals learn new coping skills and improve their overall quality of life. While coping strategies can be highly effective, it's important to recognize that they may not work for everyone. Some individuals may feel overwhelmed or lack motivation when trying to develop coping strategies. In these cases, it can be helpful to seek guidance from a mental health professional or support group. There are many different types of coping strategies, and it's important to find what works best for each individual. Some individuals may find that exercise, hobbies, or spending time in nature are effective coping strategies, while others may prefer journaling or meditation. It's important to experiment with different strategies and find what works best for each unique situation. Remember, managing chronic illness and mental health is a journey, and it's important to take it one day at a time. Seeking help when needed is a sign of strength, not weakness. We'd love to hear your tips and experiences for managing chronic illness and mental health, so please share them in the comments below. Thanks for watching. If you found this video helpful, be sure to subscribe for more content. And if you've enjoyed this video, make sure to share it with others. Take care of yourself.